राकेश सर नमस्कार, चितोड़ा सर नमस्कार.
Sir, we are not audible.
राकेश सर अनम्यूट.
Can you hear me now?
Yes, sir. Yes, sir. Yes.
नमस्कार सर, आप सबको बहुत बहुत नमस्कार. धन्यवाद. मैं डॉक्टर राकेश चित्तौड़ा. ठीक है सर, और सुनाए कैसे हैं सर?
बस सर सब अच्छा चल रहा है. एंड नाइस टू सी यू आफ्टर अ लॉन्ग टाइम.
थैंक यू वेरी मच.
सर हम स्टार्ट कर लेते हैं.
हाँ, यस बताएं सर, प्लीज स्टार्ट.
Destroy cardiovascular problems before they destroy you. Exercise should be regarded as tribute to heart. A healthy heart is a key to life. Namaskar, Sat Sri Akal, a warm good evening to one and all. On behalf of the Department of Physical Education and on my personal behalf, it is my immense pleasure and honor to welcome you all for national webinar on exercise, mother of heart, at this great evening. Ladies and gentlemen, I feel honored to extend my warm welcome to Professor Raghavendra Prasad Tiwari sir, Honorable Vice Chancellor, Central University of Punjab, a great educationist and administrator. With bottom of my heart, I welcome you, sir. Medicine cure diseases, but only doctor can cure patients. Now, I extend a gracious welcome to a lifesaver, philosopher, and sports lover, Dr. Rakesh Chitoda, cardiac surgeon and additional director, Fortis Escort Hospital, Jaipur. Dr. Rakesh Chitoda is a well-known expert, proficient in the field of bypass surgery, valve surgery, and vascular surgery. He has a special interest in minimal invasive cardiac surgery, total arterial CABT, and valve repair and replacement. He has an experience of working with Dr. Naresh Thararan at Escort Hospital, Delhi from 2003 to 2007, where he learned various advanced techniques of bypass surgery and robotic surgery. He has an experience of more than 5,000 cardiac surgeries to his credit. He is the only trained cardiac surgeon for endoscopic conduit harvesting in Rajasthan. He has awarded fellowship of IACTS in 2018. He has exposure of attending and presenting the research paper at various international platforms. With core of my heart, I welcome you, sir.
Thank you.
Well-wisher is not a word, not merely a relationship. It is silent promise which will be with you forever. Now, I extend my wholeheartedly welcome to our beloved Dean Student Welfare, Professor Vinod Kumar Garg, a great educationist, researcher who is in top 2% Indian scientist in environmental sciences discipline, and a kind-hearted personality who accepted our hearty invitation to be the part of this program. With merging of mind, I welcome you, sir. I would like to extend a heartfelt welcome to Dean School of Education, Dr. Sankalal Bika, sir, expert of inclusive education and abundant philosopher, who always provide us all kind of support and motivation. Sir, I welcome you at this great evening. I would like to extend a warm welcome to all the viewers for joining this webinar. At last, I would like to welcome and thank everyone present over here. Thank you so much.
Thank you.
Now, sir, it's over to you.
No. Should I start the presentation?
Yeah, yes. Sir. National University Anthem.
No, we were asked. Okay. And
okay. So now I am switching to my presentation.
Mute.
Good evening, everyone. who is present here and just spared time to interact with me. And I am especially thankful to Professor Sanjeev sir that who always remains very kind to me, and he communicates to me with reasons, without reasons, and he is so friendly to me that I always feel obliged by him. Today, he has given me a task to deliver a lecture about that you should tell something about exercise and the disease of the heart, because he requested, sir, you know better about the heart, so you should share with us. So today I am just presenting that topic which we want to discuss today is exercise is the mother of the heart. So, starting my lecture, I will not take much time, and I think that it will be better. I should speak not only in English but in common language so that everybody can imbibe the things what I mean to say. Okay, so going forward, it is about this is picture is of my hospital at Jaipur, which is a 300-bedded hospital. I am working here since last 15 years, did more than 7,000 cardiac surgeries. I am very happy here. Now, today we gather to learn about the benefit of the exercise of the heart. First question comes, why heart is important in the body? What is heart? There are multiple organs in the body. Brain, heart, liver, kidney. Well, it is a factory which nobody can judge how it works. But why the heart is so important in the body? I would like to say that heart is engine of body. Why? Because the life starts from this. This is the first organ of the body to start functioning, and you will be amazed to know that when a child is there in the womb of the mother, जब माँ प्रेग्नेंट होती है तो 5वें सप्ताह में ये काम करना चालू करता है, and this is the last organ which is when stoppage stops and the death is declared. So this is the organ, only organ which defines your livelihood basically. So I mean to say, therefore it is the heart is very important. Without the heart we are nothing. We are just a bundle of muscles and all the आप हिंदी में कहना चाहें जो ईश्वर ने 5 तत्व बनाए हम सिर्फ उसका मिश्रण रह जाते हैं. जो जीवात्मा है वो हमारे हार्ट से ही डिसाइड होती है. ये आपको और हमें सभी को पता है. हार्ट क्या है? I would like to tell you, heart is just like एक मुट्ठी के बराबर क्या एक मांसपेशियों का गुच्छा है. It is just about the size of a fist, and the weight of this is around a pound, means 450 to 500 grams. And very funny thing here is, I hope that all the ladies who join will pardon me for what I am telling right now. महिलाओं का वजन, दिल का वजन पुरुषों से करीबन 80 से 100 ग्राम कम होता है. इसका मतलब ये बिल्कुल ना लें कि महिलाएं छोटे दिल की होती है, नहीं तो बहुत सारी महिलाएं मुझे अब्यूज करेंगी. हाँ, महिलाओं ये शारीरिक संरचना है, and it is just located behind the central bone, breastbone, which we say it is just the central bone in the chest. It lies behind that and slightly to the left. Exact position you can judge. जब आप प्लेज लेते हैं छाती पे हाथ रख के तो आपकी मुट्ठी जिस तरीके से रहती है, it is always slightly left to the center where your right hand you take the pledge. So it is just situated right there. Therefore, the pose of the pledge is always like that, and it pumps about 5 quarts, means 4.7 liter average of blood every minute. Now you can imagine that in the average age life of a person of 70 years, how much blood it pumps for a person. And this is really amazing. No artificial pump can work without any fault for so much long. Therefore, the heart is the most important part of the body. And we should be responsible. Hanji.
Sir, we are able to see your last slide only.
Okay. Just
हाँ, थैंक यू वाली हमें दिखाई दे रही है, तो काइंडली
just एक मिनट. Okay. What is it? Thank you. Last one is like here. नहीं, ये जारी है, मेरे शुरू से दिखानी है. Just a minute, pardon me. I think there's some wrong is there. Now can you see the first slide?
No, sir, it is not visible.
Just a minute. Still not visible?
Yes, sir, it is visible now.
Now you can see. Can you see now?
Yes, sir, it is visible.
Visible. Now I'm just forwarding. This is my slide with photo of the hospital. This is next slide. Can you visible? The slide is changing. Okay. So what I explained is why the heart is the engine of the body. And this is about what I spoke, that where it is situated, what is the size of the heart, and how much it pumps in your life. Now this is can you see the picture? Can you see the picture?
Anji sir, we can see.
Yeah, okay. So this is the structure of the heart. As you all know, most of you must be knowing about this thing, that these are the various parts of the heart. This is the heart, and important thing is that these are the major aorta, the major artery arising from the heart which supplies blood to the whole of the body. And two important things which you will see here is these small teeny red arteries of the heart. These are the coronary arteries basically. These arteries supplies blood to this heart. So these arteries are very important. Although the heart pumps blood to the whole body and provides nutrition, oxygen, everything, but heart itself needs some blood to survive, to get the nutrition, to wash off its toxic products. So this is basically the structure of the heart. Now, basic function. What is the basic function of the heart? What I was talking right now. It is to transport oxygen and nutrition to the different part of the body and remove waste like carbon dioxide and various byproducts and chemicals from the body, and then it transfers them to the liver or kidney to detoxify the body and ultimately excretize out from the body. And the heart do another important thing. Our body and human being is the temperature is always same. So this heart, by pumping the various amount of blood during the day and night time, during winter and summers, it controls the body temperature also. It regulates the body temperature also. It helps in that. And another important thing, by pumping the blood to the whole body, पूरे शरीर में blood भेजता है. It helps us in fighting the disease also through the blood cells, which it contains like the WBCs, antibodies, and also platelets are there, which forms the clot whenever some injury is there. And it prevents the entering of the germs in the body and the various tract and various openings. So basically, it has a protective effect also. Now coming to the heart disease. What is heart disease? Commonly we know. There are multiple type of heart disease you can say. कुछ में बच्चों में जन्मजात बीमारियां होती है, which are known as congenital heart disease. Some are acquired heart disease. कुछ के अंदर valves खराब हो जाते हैं heart के. हार्ट के अंदर 4 valve होते हैं. There are 4 valves in the heart. 4 chambers, 4 valves. Valves are the door of every chamber. So it provides flow of blood in one direction only. Whenever there is a disease in the valve or some defect in the valve, the blood either entry is restricted or some leakage is there. That is known as a defect in the valve. That you must have heard in your relatives and near dear ones. But here I would like to talk about the disease of the heart. Heart disease here means the disease of the heart vessels itself, which I shown in the earlier picture, basic picture of the heart, the small tiny red arteries running over the heart muscles. These are the coronary arteries, which I call coronary artery. Whenever there is a problem in this, blockages are there or cholesterol deposition is there, patient has heart attack or angina. So the heart disease is common and it is more common in males than females. Females up to the age of menopause are somehow protected because of their hormones. But after that age, the incidence is same in males and female. Okay, so it is by gender, it is common in male, but females are not excluded. And definitely, as you know, it is common in older age group, basically about the age of 50 years. But after the experience of 21 years in cardiac surgery, I experienced that the age of having a heart disease is decreasing rapidly. Day before yesterday only, I operated on a 30-year patient, 30-year young chap, and the arteries were very badly diseased. There were multiple site cholesterol deposition, but I tried to give him the best of what is available today, and he is happy right now. So, although it was known to have that the heart disease will happen after 50 years, but nowadays it is happening in earlier age group also. There are multiple reasons which we will discuss after the presentation. Coming to the next slide. If we talk about the Indian scenario of heart disease, I would like to say that nowadays it is the most leading cause of death in India. Once upon a time, cancer used to be the leading cause of death in India, but nowadays the heart disease is the leading cause of death in India, and you will be surprised that it is higher than the European and American countries. And Indians, as I told, Indians suffer from heart disease a decade earlier averagely than the rest of the world. And as you know, once a family member gets heart disease, it is a great burden on the family. And as well as the incidence of this heart disease is increasing in India, it is a great burden on Indian government also. And ultimately, directly or indirectly, it is affecting all of us. Now I would like to share a video by which you will come to know that how the heart works, how this heart disease happens. That is, a disease, coronary artery disease happens. This is video. Can you see the video?
Hanji sir, we can see. Kindly play it.
Yes, I am playing it.
नीचे से
Just a minute. Now can you see this?
Hanji sir.
Okay. So this is heart. These red vessels are the, what you can say, tubes are the coronary arteries which runs over the heart. It supplies the blood to the heart muscles. Okay. This is, now you can see better. This is artery. What happens? Normally the blood flows like this. Normally these tiny particles are the red blood cells. Once the deposition is there, cholesterol deposition, it narrows the artery. Initially you just feel only pain when there is an insufficient blood supply, basically at the time of exercise, but sometimes it ruptures, and as we know that there is a tendency of blood to clot at the injury site, there is a clot formation and patient suddenly has a severe heart attack. This is how it happens. Another mechanism happens at the time of stress. Stress causes this vasospasm. That is the constriction of the artery. As we have heart की टेंशन हुआ, हार्ट अटैक आ गया. वो उस समय इस तरीके से होता है ना? Another thing is which can happen in a hypertensive patient is a just tear in the inner layer and clot forms there, and by that heart attack happens. And once the heart attack happens, this black area you can see, this is an area where the muscle has died. Okay, so this is the basic thing that shows us that how this happens. What are the various cardiac risk factors? Some are non-modifiable, some are modifiable. Non-modifiable means which we cannot change. Well, first is definitely age, as I told you, higher in the older age group. Males and female ratio definitely is there, which we can't change. And hereditary. Hereditary means a disease happening in the family. There are multiple regions, genetic regions, which runs in family, and in those families the heart disease happens at the early age and the severity is always higher. So these three things we cannot change if somebody has in their family. But there are many things which are modifiable which we can change. Amongst those, the major are tobacco use, cigarette smoking, canning, and high cholesterol levels. You all know that depends on your food habits. And this is food habits are definitely very bad in our newer generation. They are more dependent on these junk foods, ready-made foods, rather than our old style of having food at home, home prepared food, which were definitely very nutritious. And India is very famous for having different kind of food in the different season. And we always used to love, the ancient history tells us that we always eat the food which is available in that particular season. If you believe in nature, nature always flourishes the things in particular season which is most suitable for that season. So if you are eating the seasonal things made at home, then you will be fine, you will not suffer any bad things. Third is blood pressure, definitely, which is again there are multiple regions of blood pressure. Diabetes is most important thing. Here I would like to emphasize on diabetes. Being a cardiac specialist, diabetes is the leading cause of heart disease, blood pressure, obesity, high cholesterol in India. And I'm sorry to say that India is becoming the capital of the world for diabetes. It is estimated that by the end of 2030 or 2035, half of the diabetic patient of the world will be in India. So this is a worrisome thing. Nowadays it is happening in the very early age group. The people are getting affected, and once that diabetes happens in body, it kills you by many means. It is a phrase is written in our textbooks, which is a very pioneer textbook, Harrison, that diabetes can lead to anything, any disease in the body except pregnancy. So this is a very funny thing. Looks funny, but it is not funny. It is a serious thing. Means diabetes can affect any organ of the body. Now, next is a physical inactivity is a very major risk factor nowadays, because as we all know, the world has progressed. We became mechanized. We have facility for everything. We need not to move. We are digitalized now. We are sitting apart and talking to each other. I think 25 years ago, we used to go to somebody's house. We 5 or 7 friends or doctors meets, and then we used to discuss the things. But here we are sitting in our comfortable zone and talking to each other. That has increased the physical inactivity, and that definitely has given a bad impact on our heart disease. Overweight conditions, as you all know, physical inactivity definitely leads to overweight, And another important factor, as I mentioned earlier, is our food habits. And last, but it is not the least, I will stress it on later on, that is a stress happening nowadays, particularly in the youth. This is the biggest reason and why it can cause heart disease, that I told you in that video, that whenever you are stressed, there is a spasm in the artery, which accelerates the disease process. So it is very important to handle the stress. Now coming to the our topic, as we discussed, the exercise. Exercise, if we do the exercise, what happens to our heart? First of all, we should know that, then we can discuss that what kind of exercise we should do, how much should I do, whether if I'm not doing, what else I can do, if I am physically handicapped, what are the other means, I am so busy, how I can do that. I will answer it in the later presentation. These are the exercise has following effects on the cardiovascular system, on the heart size, on plasma volume, means amount of the blood, excluding the red blood cells. Effect of the stroke volume, effect on heart rate, cardiac output, oxygen extraction, effect on blood flow and distribution in the body, and but another important is effect on blood pressure. Heart size. What happens to heart size? Well, once you exercise? Aerobic exercise, you all know, you are in the field of this. A very active exercise which you do is aerobic exercise. Aerobic exercise is usually enlarges the heart by increasing left ventricular cavity size and thickening of its wall. Left ventricle, as you know, there are two ventricles and two atria in the heart. Two atria are the upper chambers, two ventricles are the lower chambers. The left ventricle is responsible to pump the blood in the whole body through this larger vessel aorta. So heart increases by doing the exercise. So once your heart muscles gets stronger, your heart can pump better amount of blood per beat, and your body will be well oxygenated and well nourished. And this type of enlargement is known as eccentric hypertrophy. Endurance training is associated with an increased cardiac output and volume load on the left and right ventricle both, which causes the endurance trained heart to generate a mild to moderate dilation of the left ventricle, combined with mild to moderate increase in left ventricular wall thickness. Means overall exercise slowly improve the muscle mass of the heart and increases the pumping capacity over. Now it has effect on the plasma volume also. Once the heart is trained to increase the volume of plasma increases up to 20% higher than the untrained people, and it happens within the few training sessions. This adaptation enhances the circulation of thermoregulatory dynamics in the body, and definitely it facilitates in the oxygen delivery during exercise also. So once the volume of the blood and blood product increases, it helps in many ways. It can transport better nutrition, better oxygen to the whole body. Thermoregulation is better, and overall nutrition and pumping. Once the pumping gets better, every organ gets a better supply of the blood, better nutrition, and definitely your overall body is well managed. And plasma volume definitely rapidly increases with the aerobic training, which also contributes to training-induced eccentric hypertrophy. So it is a cycle. Once the volume increases, definitely heart has to pump more volume, then it again gets strengthened by itself. Once it gets a message from the brain and the whole body that now you have to work hard, so it strengthens itself also. Stroke volume. Do you know stroke volume? Stroke volume is the amount of blood ejected by the left ventricle in one contraction. Means how much blood is pumped per beat is a stroke volume. It is measured in milliliter per beat and generally has a normal value of 1 ml per kg. If you are a 50 kg guy, means per beat you should eject 50 ml of blood. You must have heard कि में उस एक हमारे रिश्तेदार का हार्ट तो 20% ही काम कर. What does it mean? Means it is pumping only 20% of its capacity. If it can pump 50 ml, it should do. Instead of that, it is able to pump only 10 ml of blood to the body. And definitely, you know, if it is not pumping good, the patient may not feel well. His organ will not get enough supply, and slowly, every organ will get diseased, and definitely, it will be tough for him to survive. So the long-term aerobic exercises or training increases the stroke volume. And once the stroke volume increases, if by training your stroke volume increases, as we told that the plasma volume will increase, heart muscles will increase in size, so there is a capacity to increase the stroke volume. Once the stroke volume will increase, the per minute 5 liters we have to pump, so your heart rate will go down. Okay, so lower heart rate in a trained aerobic exercise person is not a bad disease. If you are doing regular exercises, your resting heart rate will come down because your heart is pumping more blood per beat. So your body's requirement is met with a slower heart rate. So the normal stroke volume ranges at rest is around 60 to 80 ml, and during peak exercises it can eject up to 130 to 140 ml per beat. Heart rate, as I told, resting heart rate, as you all know, is between 60 to 80. Average we take is around 72. Heart rate is directly proportional to exercise intensity, as I told earlier. If you do exercise daily, your heart rate becomes slower. You must have observed the people who live this sedentary life, their heart rate is very high. Or once they get anxious, their heart rate increases rapidly. They feel palpitation, ghabrahat. And the maximum heart rate you can calculate by a simple formula, that is 220 minus your age. That is the maximum heart rate which you can achieve by doing exercise. If you are doing exercises and your heart rate increases, then your heart rate can increase up to that area. Suppose my age is 50, so my heart rate during peak exercise should be around 170. And I should only achieve the 80 to 90% of that heart rate. If my heart rate is increasing beyond that, then you should stop. Because whatever if you are doing gymming, cycling or every machine nowadays has some sensors which shows your heart rate. So when you are doing exercises, if you can see that monitor, if your heart rate is increasing beyond your suggested heart rate at the peak exercise, you should stop or you should slow down at the each, because the higher heart rate sometimes can trouble you. Cardiac output. What is cardiac output? As I told, it is amount of blood pumped by the heart per minute through the circulatory system. If my heartbeat is around 60 per minute, so the total amount of blood pumped per minute is cardiac output. And cardiac output is the calculation of stroke volume and heartbeat multiplied. Here you can see cardiac output is a stroke volume and heart rate. If your stroke volume is higher after exercise, your heart rate will go down, so your cardiac output will be maintained. If your heart rate increases, your stroke volume will come down. So it is a vice versa. So it is the amount of blood pumped out of the left ventricle that supplies blood to the muscle and organ of the body. And this is made of stroke volume and heart rate multiplied. And cardiac output increases during exercises due to relative high heart rate that are achieved during exercise. During exercise, definitely you need more blood in the body, so cardiac output should increase. And how it is being done? By increasing your stroke volume as well as your heart rate. Oxygen extraction. At the resting condition, I am audible to everyone now? Am
Sir.
I audible?
Hanji sir.
At the resting condition, the oxygen content of blood varies from about 20 ml of oxygen per 100 ml of arterial blood. As you know, there is a arterial blood and venous blood. Means a pure blood, impure blood. The arterial system has around 20 ml per 100 ml, and this oxygen is carried in blood by the red blood cells as well as by the plasma, which I told earlier, plasma volume. So it is dissolved in plasma also, and it is also combined with the red blood cells, hemoglobin. So in the arterial system, it is around 20 ml per 100 ml, and in venous it is 40 ml. Means once the blood from the heart goes in the body and comes back to heart, it delivers around 100 ml of blood delivers around 6 ml of oxygen to the various organs. And this difference is known as VO2. When exercise intensity increases, this extraction of oxygen increases also because the organ requirement increases. So this AVO2, arterial VO2 and venous VO2, the difference between them becomes higher during the peak exercise. Aerobic training significantly increases the quantity of oxygen accepted from arterial blood gas during exercises. So here I would like to summarize. If you train your heart, your stroke volume increases, your plasma volume increases, your oxygen carrying capacity increases, and that is able to give the more oxygen needed at the time of peak exercise. So this is how it works. Now coming to blood flow and distribution, what happens to that? During the exercise, as you know, that every organ needs muscles flow, muscle needs more blood. So during exercise, there is a great increase in the muscle blood flow during maximum exercise, and it becomes only because of the improvement in maximal cardiac output, redistribution of blood from non-active areas that temporarily compromises blood flow all out of effort, and increase in capillarization within the trained muscle tissue. What is capillarization? If we start training the muscles, you have seen in that this builders, the bodybuilders, there are the large vessels running over their body. Those are the veins. But the same happened within their muscles, which has the arteries that which contains the pure blood, oxygenated blood. So overall capillaries, the network of blood vessels increases after exercise. So blood flow and distribution is also increases after the exercise. Blood pressure, what happens to blood pressure when we do the exercise? As we all know, resting blood pressure is 80, 60 to 90, average 80 lower side, and upper side is 120, ranging from 110 to 140. That is the normal blood pressure. But what is blood pressure? It is the force exerted by blood on the wall of blood vessel is known as blood pressure. Enough? So, normal blood pressure is this. During exercise, your systolic pressure increases because the heart has to work more forcibly and it increases the blood pressure in the wall. And definitely the blood volume has increased during exercise, so everyone causes a more pressure on the arterial wall, and that is blood pressure increases during exercise. Just a minute. This is all about what the exercises causes with our body regarding our blood circulation, oxygen and heart size, heart rate, stroke volume, cardiac output that I had explained in short. Now, why I should do exercise? So the most important question comes that why should I do exercise? Although I have told lot many things to you, how it affects my body. Here I would like to emphasize, once you start doing exercise, as I told you, every system gets better, every organ gets better supply. It flushes your kidney in better way, your kidney functions gets better. It gives more blood supply to liver. Liver is responsible for metabolizing your fats. So your fats gets in a better shape. Your bad cholesterol will come down, good cholesterol will go up. And that only happens with the exercise. Your blood pressure, what happens to blood pressure? As I told, it increases the capacity, strain, training of the blood vessel wall. So it controls your blood pressure also. If your body is tuned for the higher exercises, your arterial wall gets tuned to handle the pressures. Their compliance gets better. Their ability to contract and relax gets better. Fat deposition is less in that. So it affects in that way also. It controls the diabetes also. So these are the various ways by which the exercise helps you in doing the good things. What are the recommended exercises? Some of you are related with the physical education. You know more and more than me about the exercises, what to do. Youth can do anything. They can jump from the height, they can do the parasailing, everything they can do. They can play 10 hours in a day. Athletes do that, 8 hours training in a day. Or cricketers play 8 to 10 hours in a day. But I'm just talking about a normal layman of the age of 50 or 40 or 60. That recommended exercise for an average man is around 20 to 30 minutes of moderately intense activity, at least 4 to 5 days in a week. If you are doing regularly, then nothing can be better than that. And you can do various kind of exercise. Nobody says you should do this, you should do this. It is not like that. Whatever you are doing for 20 to 30 minutes in a day, and that is moderately intense, you can do jogging, you can do brisk walking, you can do running, you can do cycling, swimming, or if your body doesn't permit all these things, you can do yoga. We know that being Indian, we have become guru in yoga and we have retained, and most of you must have experienced that the pranayam, anulom vilom has saved so many people in this corona time. The people who were doing this regularly or who were doing regular exercise, they didn't got affected by the corona. So this was the beneficial effect of doing exercise, which scientifically we observed that the people who were doing regular exercises, they didn't get caught by COVID and they remain healthy in this pandemic period. And that I had experienced. So people who died or who suffered a lot were only who were not active at all. So these are the things which you can do. What if I am not able to someone can say that I am so busy I can't do. So you can modify your daily activities. Suppose आपको कुछ सामान लेने जाना है घर के आसपास, तो avoid using the vehicle. आजकल ट्रेंड हो गया है हमारे यहाँ पे, छोटा सा भी सामान है अपना स्कूटर या कुछ भी एक्टिवा उठाया और जाके सामान लेके आ रहे, rather हमारे बच्चे भी नहीं करते. So here I would like to suggest you to train your family members that for the small household activities around your house, within your colony, avoid using vehicle, go by walking, bring the vegetable or milk or whatever you want to do, and train your kids also for this. If you are working in an office, instead of using elevator, if you can climb 3 or 4 stairs, better do that. That is exercise as well as daily you will do the DMT for yourself. So that is another way you can do that. Gardening, you should do some household activities like gardening, or you can choose. And here a funny thing I would like to tell you. इस समय तो करने के लिए मेल्स के लिए सबसे ज्यादा एक्सरसाइज किया जब घर पे रहे कोरोना टाइम में. अब जेल में बंद हो गए तो सबने झाड़ू पोछा किया. आई थिंक सबकी हेल्थ अच्छी हो गई. So these are the way by which you can add on the various activities in your daily routine life, and by that you can do the exercise. Or if you don't have a time of an hour or a combined time in your life, you can do small duration exercises at multiple times in a day. 10 मिनट कभी वॉक कर ली, ऑफिस में बैठे 10 मिनट वॉक कर ली, खाली हुए 2 स्टेयर्स के चढ़ के वापस आ गए, या 2 मिनट वहां पे स्ट्रेचिंग और थोड़ा बहुत अपने एक्सरसाइज कर ली. इसमें शर्म करने की जरूरत नहीं है, कोई भी बुरा नहीं मानेगा. Some people may make joke on you, but by doing that you are not making their heart healthy. You are making your heart healthy. So be focused on your health, make your heart strong, and definitely it will give you more years in your life. Here, I would like to add on some various benefits of exercise. As I told, some of things I have told, it reduces body fat, it increases the lifespan by just adding more years in your happy life. It oxygenates body heavily, strengthens the muscles, overall body muscles, and definitely you must have observed the people who do the regular exercises, their backache, another various pains, cervical spondylitis, or body pain, muscle pain, that is very less. It gives a power to fight with the various viruses. I give an example right now. It reduces the diabetes risk by burning more calories. The overall sugar consumption increases within the body. So your body sugar is being utilized more and your risk of diabetes goes down. One other very important thing, that is a mood. It boosts your mood. It improves your memory, improves coordination. It increases the calcification in your bones. So it strengthens the bone also. The people who do exercise here, if you calculate the BMI and the very body mass structure, their bone density is higher than the people who don't do the exercise. It increases glow on your face. It shapes your body. So overall look improves, and particularly it is helpful for the girls. It detoxifies body by just flushing off all the waste products. It reduces cancer risk. It is very significant study has been done across the world that the people who do exercises, they suffer very less from the cancer. The chances of having cancer in this patient is 40% lesser than the common person. It boosts the immune system. Body immune system gets stronger. And another important thing, which is my favorite topic, is it reduces stress. When you do the exercise, you all must have observed that when you are doing exercises, your mood gets better, your stress level goes down. And nowadays, in the last 20 years of my practice, I had observed a very lean and clean, regular exercising people having normal cholesterol, no diabetes, no family history, had a very bad heart disease. And when I inquired in detail, the only reason which I found was the stress. So stress management is very important nowadays. We all know in the present scenario of lifestyle, the stress is very high, particularly in the youth, particularly in you and me people who are working in big organizations. There are stress of targets, stress of earning more, stress of family to earn more, stress of comparing ourselves with the surroundings that he has more than me, and we get stressed. So because we forgot to learn the level of satisfaction, we always compare ourselves with the others. I'm not saying that we should not be ambitious, but nowadays we all are becoming over ambitious, and that is giving stress to us, and this stress gives us multiple problems in way of the reverse of what I mentioned here in the benefits of exercise. The stress always gives negative of everything, whether it is a immune system, whether it is a cancer risk, whether it is a toxification of body, whether it is a complexion, bone density, memory or coordination, diabetes increases, virus load increases, you will start feeling pain, you become dull, you don't eat proper. So it causes everything to you once you are stressed. So I think that we should know how to manage stress. And in my experience, I play golf maybe for 2 or 3 hours very early in the morning. And I know, I proudly say that that is the best time of my day when I remain stress free. Early in the morning hour, I see sunrise, I hear chirping of the birds, I see the greenery, fresh air, and by that I reduces stress at least for those 2 or 3 hours. And I do some exercises at that time, although the God doesn't give you much exercises, but it gives you benefit of socialization, your mood elevation, and bit of walk in nature, and that definitely is helping me. So here I would like to conclude by saying a very good saying of Hippocrates, that is, if you are in a bad mood, go for a walk. If you are still in bad mood, go for another walk. Definitely you will get better. So with this, I end my talk and I thank you all for patiently listening. And now I invite for any questions, queries, or whatever you want to ask.
Questions?
Yes, sir. Definitely, there will be some questions of audience.
Yeah.
So now we request audience, if they have any questions, kindly ask. Sir, being a host, I want to become a first audience to ask question.
Yeah, please, most welcome.
Sir, like you said, कि aerobic exercise is good for heart. Yeah, definitely. With your presentation, it is really very clear. But I also want to know, is strength training, especially like the people are doing some exercise in the fitness centers, doing lots of dumbbell exercise, resistance training, is it also good for heart?
It is good for heart if it is done under supervision, and it all depends on your age, nutrition, and everything. It should be done under supervision. What is happening nowadays, I had seen so many people, either you should do it on regular basis. The people do it for a few months, then they stop it. Then again they do it for a few times. Only a few percentage of youth are doing it on regular basis. If you are doing it, it is definitely good for heart. Whatever kind of exercise you are doing, it is good for heart. Youth can do in better way. Definitely it improves our heart and the benefits which I told. So I don't say that doing this aerobic and strength training is bad, but it should be very managed. Not only strength training, along with that some flexible trainings, some yoga, those things should be combined with that.
Chat box.
Right. Thank you, sir.
Dr. Garvit, actually, one attendee has typed a question. I would like to ask that question on the part of attendee. Can I ask Sanjeev ji that question?
Sir, please, sir.
Here, the attendee is Sandeep Ruhel. He has typed a question that many times I have chest pain in many parts of the chest, especially in the left side. Is this heart disease or not?
No, it is not always heart disease. You may have pain in the chest area because of some muscle pain or bone pain also. If you have some associated things with you or something like that, or your chest pain happens more with exercise, better to consult your local physician, get an ECG done, or other investigations he should get investigated, and then only he should come to a conclusion whether it is a heart pain or not. It may be heart pain, but I am not sure. It is not always there. The person having some chest pain somewhere in the chest is always heart pain.
Seen
So
in
I
books
think,
and-
Garvit ji, Sandeep ji, your question has been answered that you should go for a proper checking for that, so that a doctor can find out the cause, that what is the
Yes.
cause of that. And there is one more question, Dr. Saab, from Sandeep Ruhel, that every day he is running about 4 kilometer with medium speed on daily
Yeah.
basis, 5 days a week. Is this long running maybe cause of heart disease or something like that?
No. Running always helps you. As I told, running, jogging, or brisk walking, it strengthens your heart and it is always good. But
Thank
if he late during running or something, that I will suggest that he should consult his physician and get him. He should get checked. If everything is okay or not.
Thank you, Dr. Saab. Thank you.
Dr. Rakesh ji, I wanted to hear from you. Many people, they are taking something. It happened pain, and they are they are going for doctor, and there will be a stunt. Continuously, they are putting stunt. Sir, वो थोड़ा सा उसके बारे में बताइए.
देखो ऐसा है, कभी भी यदि किसी को चेस्ट पेन होता है और डॉक्टर के पास जाते हैं तो डेफिनेटली ही डूज फर्स्ट ऑफ ऑल ही कैन नॉट पुट स्टेंट विदाउट डूइंग एंजियोग्राफी. So he does angiography once. If he finds blockages in that, definitely he puts the stent. Sometimes the situation is always worrisome. Cardiologist says, okay, 1 or 2 blockages are there. Okay, stent is okay in a younger age group. But a patient having multiple blockages in all the 3 arteries, then I don't think, and even literature don't suggest that you should go for a stent every time. If the patient has a multiple blockages, all the 3 arteries are involved, calcium is there, or a diabetic patient is there, they should prefer to go for bypass rather than having multiple stenting. क्या है, होता क्या है कि चाकू से हर किसी को डर लगता है. Nobody wants to have knife on his chest. So people get afraid, and the other physicians take the advantage of that. I'm not criticizing my faculty, but this is happening, and you all must have observed this also in society, that this is really happening. So my view always remains that it should be a cafeteria approach. What is cafeteria approach? Once there is a multiple blockages, the patient and doctor, surgeon and cardiologist, they all should sit together and they should decide the best option for the patient which can give him a long-term beneficial result. That should be the approach. But you know, in Indian scenario, nobody has time, there are multiple things happening around, so everybody does according to his convenience. That is my feeling.
Thank you, sir.
Please.
Sir, due to the pandemic, now most of the players they couldn't continue their training, so they are rest almost a month, an year. So when they started playing recently, even one of my friend also he collapsed. There are many recent news are there. So this death, and they found the reason will be the heart attack. So
Yeah.
what exactly happened?
A great example of Gorgula is there in front of all of us. You know, do you agree with me?